Hello and welcome to this episode of Jing TV. Today we're going to talk about massage education and specifically, do we need a degree level education in massage therapy when it's just about rubbing people up and down?
I know, yeah, I know why. Why should I actually learn anything? So this is really a big topic. It's like, you know, Rachel and I, and of course Rachel should talk a little bit more about her experience having educated first in the UK and then come over to the US to do a degree in massage therapy. It's really interesting. There have been a lot of activity around why should people go for a 3-year degree that involves academic understanding of the research and what's out there in the world of touch, when really massage therapists are kinesthetic learners. I think there's a lot to that.
Yeah.
And really this is a vocation, so it's the idea of doing hands-on work.
Vocation.
So why spend 3 years doing a BTEC 6, which is one of the things that what we've developed at Jing versus a 4 or something along those lines.
Yeah, I mean, my mum always says to me, whenever I go in a new course, what more could you possibly learn need to learn about in massage therapy? And I think most of you out there are doing massage, maybe feel the same way as me and Meg, that actually the body is a never-ending story, really. It's a beautiful jewel of information, isn't it, that we can always learn more about. But in terms of my own experience, because you mentioned me there, I did a qualifying course in the UK first, back in the early 90s, when the qualifying level was around 100 hours. It's fairly similar now in the UK. And although I learned to do a great relaxation massage and loved doing that, I just felt like I really needed to know more. I didn't know enough anatomy and physiology. I specifically didn't know enough about pathology. I think that was really important. So people are coming in with all kinds of conditions and I just didn't actually know what was going on for them or feel safe around massaging. What should I do? What shouldn't I do? I felt quite inferior. I did think about doing osteopathic or physical therapy education, physio education, but I just felt like I really wanted to be a massage therapist because massage therapists do heal with the hands and the head and the heart, and I was as interested in treating somebody's herniated disc as I was to helping them heal from the trauma of sexual abuse. So I wanted to really encompass all of those things. So my journey actually led me off to the States, where I did a 2-year degree level course, an associate's degree at New York College of Holistic Health and Education, which is still going. It's a wonderful education. Thank you for that, guys. And of course, over the last 5 years, we've set up a similar level of education at Jing.
Yeah, and I think the core about this is about being an expert. I mean, there is nothing out there. I know, there's nothing out there where anybody's an expert at anything who does anything less than a 3-year course. Yeah. So, you know, I find that really fascinating. It's like, why would anybody turn down education? So what a BTEC level 6 or doing a degree level education allows somebody is to feel really secure in their hands-on work. So it gives you space to practice under supervision, understand all the different disciplines of techniques. So of course we go through trigger point and myofascial release and orthopedic assessment and all of those core elements. But the fine-tuning here with the BTEC 6 is that people get to do their own project. They get to decide something that they want to feel that they can be an expert in, which they produce in some kind of dissertation or different kind of format of a project. So for instance, some of the projects that come through through Jing are things like people deciding to look at women post-operatively with breast cancer and what myofascial release can do for them, increasing their range of motion or their quality of life. Also dealing with people who've had you know, stroke patients and researching and actually doing a research project. So it's like designing it, understanding what it means to do disciplined research around, right, well, this is how they presented on day 1. They received 6 treatments that were exactly the same. They were measured in a rigorous way. And then at the end of the project, you can say, well, actually 50% of the people were able to reach a shelf or were able to drive for longer periods of time or whatever that you want to measure. And so that you can speak with authority and really understand how you read journals, understand what's happening in osteopathy, understanding what's happening in physical therapy. So it's not that massage therapy is an isolated thing.
Yeah, exactly. And this is absolutely the way the world is going with massage therapy and body work. And I think the key for me what we aim to do on the BTEC Level 6 is to teach people to really think about their profession and to analyse. And I remember on the first day of the BTEC last time, and we asked people, why do you want to do this? And I was really struck by the answers, because people said, I want to be the best and I want this profession to be credible. And it wasn't, obviously it was a personal thing, but it was also a journey for all of us in terms of raising the level of massage therapy as a credible profession in its own right. And that's the mission, really, isn't it?
It is the mission.
Yeah, it is the mission.
And I feel that it's a hard ask to be a professional in a new realm with only getting 150 hours training or whatever the basic training is, even a year of part-time education. It seems that's quite challenging for people, and a lot of people come to Jing and say, well, I did my basic education and I came out of that feeling like I understood a little bit more, but I didn't feel confident enough being able to treat quite complicated chronic pain conditions. And so choosing to do a degree, and it might not be for everybody, but choosing to do that degree level education will give the person who chooses to do that a real belief in themselves and feel that you can be in the same league as other complementary therapists, such as osteos and physiotherapists who do 3- and 4-year degrees. That's what they do. So why not do that as a massage therapist if it's on offer to you?
Yeah, it's about investing in yourself and investing in your profession, isn't it? And ultimately, we all just want to help people more, and without a doubt, this is the way.
And we've done it with looking at how universities would support that. So, you know, it's not like the degree is something about just doing more vocational understanding. It's about being able to read and understand what it means to do research. I mean, I think that this is totally misunderstood, and I think it's really important that people get involved with it so that you can go to conferences and dialogue. And also, you know, people are always interested in how do I approach GPs, how do I deal with sort of conventional medicine and let them understand the power of massage therapy. And the way to do that is to be educated, be able to speak the jargon, be able to understand what people are coming from, so you can connect with it rather than feeling like they're just in a different playing field altogether. So these are the reasons we put together the BTEC Level 6. This is why we think you should, or people who'd want to do a BTEC Level 6 should do it. We take 25 different people through it every year, and it's really such a change in the massage profession in the UK. So we're really open to your dialogue around it. Get involved with it on Twitter, Facebook, and always come to Jing in Brighton.
And if you're out there and you've done the BTEC Level 6, let us know how it's made a difference to your practice.
Absolutely.
Yeah. Thanks for listening. Look forward to seeing you at Jing or next week on Jing TV.
Great.